Module Overview. This module addresses the often overlooked psychological dimension of rehabilitation. While physical recovery is measurable through mobility, strength, and functional scores, mental and emotional well-being significantly affects a patient's motivation, engagement, recovery outcomes, and overall quality of life. Rehabilitation Support Workers, RSWs, must develop the emotional intelligence, communication techniques, and basic mental health first aid skills to identify psychological distress, de-escalate emotional crises, and offer appropriate support within their professional limits. This module adheres to frameworks from Mental Health First Aid International, MHFA, World Health Organization's Mental Health Gap Action Program, MHGAP, Skills for Care UK, Core Competencies for Healthcare Support Workers, National Institute for Health and Care Excellence, NICE, Mental Health Guidelines. Module Content 1. Understanding mental health in rehabilitation contexts. Mental health refers to an individual's cognitive, emotional, and behavioral well-being. In rehabilitation settings, many clients face depression due to loss of independence or identity anxiety due to uncertainty about prognosis, post-traumatic stress disorder, PTSD, from traumatic injuries or medical events, adjustment disorders in response to disability, grief and loss, e.g., amputation, paralysis, disfigurement. RSWs should recognize that mental and emotional distress can impede therapy, reduce compliance, and worsen physical symptoms. 2. The scope of mental health, first aid, MHFA in rehabilitation. RSWs do not diagnose or treat mental illness, but they can recognize early signs of emotional distress, listen non-judgmentally, provide reassurance and support, encourage professional help, avoid triggers and emotional harm. Key concepts in MHFA include ALGE Action Plan, approach, assess, and assist with any crisis, listen non-judgmentally, give reassurance and information, encourage appropriate professional help, encourage self-help and other support strategies. 3. Recognizing signs of emotional distress. Support workers should observe sudden mood changes, withdrawal, or agitation, expressions of hopelessness, worthlessness, tearfulness, irritability, or panic attacks, loss of interest in therapy or conversations, poor grooming or hygiene changes, risk factors, isolation, lack of family visits, history of mental illness, chronic pain, documentation and timely reporting to therapists, psychologists, or nurses is mandatory when symptoms are observed. 4. Therapeutic communication strategies, rehab support. Workers must build rapport and trust using active listening, nodding, eye contact, summarizing, empathic responses. That sounds difficult. I can imagine it's hard. Open-ended questions. Can you tell me how you're feeling today? Avoiding judgment or unsolicited advice. Using person-first language, a person living with depression, not a depressed person. Cultural sensitivity, tone of voice, and respect for silence are key in emotionally charged moments. 5. Boundaries and referral protocols. It's vital that RSWs understand their role does not include therapy. Refer clients showing suicidal ideation or hallucinations immediately to the appropriate clinician. Use chain of command, e.g., nurse, psychologist, psychiatrist. Follow protocols regarding safeguarding, abuse disclosures, or emergency mental health episodes. Maintaining professional boundaries and confidentiality is crucial to ethical care. 6. Support techniques for common conditions. Condition, support strategies, depression. Encourage expression, create a routine, avoid cheer-up comments. Anxiety breathing techniques, grounding exercises. Reduce overstimulation, PTSD. Avoid triggers, offer consistent and calm care. Grief. Provide space to talk. Validate loss without pushing to move on. Cognitive disorders, e.g., dementia. Use memory aids. Be patient. Reduce confusion with signage. Understanding that emotional care enhances physical recovery is central to modern holistic rehabilitation. 7. Self-care for rehab support. Workers' compassion fatigue, burnout, and secondary trauma are risks for care providers. RSWs are encouraged to use debriefing sessions, seek peer support, maintain work-life balance, engage in mindfulness, breaks, hobbies, or spiritual support. Access mental health resources when needed. Healthy support workers offer healthier support to clients. Learning objectives. By the end of this module, you will understand the role of mental health and emotional well-being in rehabilitation outcomes, demonstrate awareness of the signs of emotional distress and basic first aid responses, use therapeutic communication to support clients, know when and how to escalate psychological concerns, prioritize self-care to maintain professional capacity and emotional resilience. Click the button to subscribe.